Hey future nurses, welcome to the GCS part 3 and today we are going to cover the motor response. So in motor response, we check how patient moves after giving a command or after giving a pain stimulus. So in the motor response, the higher score is 6 and we give this score when the patient obeys command. For example, if we ask the patient to lift his hand or if we ask the patient to show two fingers, the patient does the exact same thing what we ask him to do. So in this scenario, we will give the score 6, which shows a good brain function. So score 5 is given for the localizes pain, which means the patient tries to remove the source of pain. This shows the brain can recognize the pain and purposefully react to it. For example, when you apply a pain stimulus like you are pressing the nail bud, then the patient uses their hands or arms to reach towards the pain or try to push your hand away or try to stop the painful stimulus. Coming to score 4. Score 4 is given when the patient withdraws from pain. In this, the patient pulls back their limb when the pain is applied. Here, the movement is not purposeful and not directed towards the pain. In this, the patient moves the hand or leg away from the pain but does not try to stop it, does not try to push your hand, does not localizes the pain. Into score 3. Score 3 is for the abnormal flexion, which is also known as decorticate posture. This decorticate posture means patient will flex their arms towards the chest and elbows will be flexed and wrist and fingers will bend inward with leg extended and rotated inward. This happens when there is a serious brain injury above the brainstem. So score 2 is given for the abnormal extension and it is also known as decerebrate posture. Here we can see a abnormal extension where the patient extend his arms straight down, elbows also extended, wrist flexed outward, fingers extended, legs extended and stiff. This shows a severe brain damage. Coming to the score 1, which is no motor response or unresponsive. Here the patient does not move at all. There is no response after giving a pain stimulus. They remain completely still. This is the lowest score. So this was all about the motor response and GCS. And remember, the highest score in GCS is 15 and the lowest score is 3. And how do we calculate the score? Is by adding eye response score, verbal response score, and motor response score. If the score comes between 13 to 15, which means mild head injury or brain injury, if the scores come in between 9 to 12, it means moderate head or brain injury. If the score comes between 8 to 3 or less than 8, which means severe brain or head injury. So that's all. Save the video for quick revision.